Hello everyone, my name is Day, and today I have Melissa and Charles with me today, and we'll be presenting you an in-service project on flu season 2020-2021. The in-service will entire title to help you to differentiate the difference between symptom of flu and a COVID-19. Then we'll briefly touch upon a current flu treatment and any new changes and updates to this year's flu vaccine. Then we'll talk about the method of storing and administering the vaccine, also possible adverse reaction from the vaccine. Lastly, we will end the presentation with brief patient case to identify patient's condition based on patient symptom and also being able to choose correct vaccine based on patient's information. Okay, the influenza is a contagious respiratory illness that is caused by influenza viruses. And it is vulnerable populations such as elder patients, children, or any patient with underlying health conditions are at a higher risk for dangerous outcomes if infected with influenza. The bar graph depicts the percentage difference among different age groups in 4 categories. And as you see, high percentage of the hospitalization and death are containing in age of 65 and older adults. And just by looking at the 2018-2019 data given by CDC, nearly 279,000 of older adults were hospitalized, and nearly 25,000 of deaths were accumulated in population above age 65. And therefore, it is so important as healthcare professionals to know everything about flu and any updates annually. Okay, for the flu symptoms, flu is a little different from a cold and coronavirus. It usually comes suddenly, and a patient with the flu will have symptoms such as fever, feeling feverish or chills, cough, could be a dry cough usually, and sore throat, runny or stuffy nose. Sometimes they feel a muscle or body ache, and it could have a headache, and most time they would have a fatigue, like tiredness. And honestly, only major difference between the flu and a COVID-19 is the symptom of a duration and the shortness of breath. In terms of the duration, typically a person with the flu develops symptom anywhere from day 1 to 4 after the infection. For the COVID case, a person develops symptoms 5 days after being infected, but symptoms can appear as early as 2 days after infection, or it could be as late as 14 days after the infection. In terms of shortness of breath, the physician says if patient cannot hold a conversation or walk from your bedroom to the bathroom, the patient is having too short of breath, and then the patient needs to go to the emergency room where they can check the patient's oxygen level. And next, Chelsea will talk to you about the flu treatment, types of vaccine, and its availability.
Thank you, Day. So there are a few options in terms of treating the flu. So we would use antiviral medications, and these actually have the potential of shortening the duration of flu symptoms by 1 to 2 days. And also the antivirals can reduce the risk of additional complications for treating the flu. The most common one is Tamiflu, and this is a 5-day treatment. And then Relenza is actually also a 5-day flu treatment. And then Rapivab is an IV treatment, so you actually get a one-time IV dose over 15 to 30 minutes. And then Xofluza is a one-time oral dose that is given as a weight-based dosing. And it's also important to note that the Tamiflu actually requires renal adjustment, so patients' creatinine clearance has to be calculated in order to appropriately dose this medication. So there are also several different flu vaccines that are available to patients. So a lot of patients ask or say, you know, I already got my flu shot before, why do I have to get it again? So the CDC actually explains two main reasons why a flu shot is recommended and needed every season. So the first one is that a person's immune protection from the vaccination will decline over time. So annually, a vaccine is needed in order to increase the amount of protection that patients have against the flu. And then the second one is that the flu virus is always changing. So this year's flu might be a different strain than last year's flu. So that's why the flu vaccines are updated from season to season so that it can protect patients against the new and different viruses. And in general, for the best protection, it's actually recommended that everyone from age of 6 months and older should get vaccinated annually. So the type A influenza is in all vaccines. So it's the H1N1, which is the Spanish flu from 1918, as well as the swine flu. And then in all vaccines, there's also type A in H3N2, which is not as common, but it did cause a lot of severe cases of the flu in non-pandemic circumstances. And then the type B influenza is what changes every year, and that's how science predicts the models of the spread and what to do with the vaccine that season. So what vaccines are available to the elderly population? So in those patients that are 65 years and older, it's recommended that these patients get a high-dose quadrivalent. So basically, what makes this high dose different from the flu quadrivalent or just the flu quad is that the high dose actually contains 4 times the antigen. So that's part of the vaccine that's going to help your body actually build up protection against the actual flu virus. Now the flu quad, and it does have, the 4 different strains of the inactivated flu. However, the higher dose of the antigen is just giving elderly populations a better immune response, which is going to ultimately give them a better protection against the flu. So next, Melissa will talk to you further about the flu vaccine storage.
Thanks, Chelsea. So once our stock of flu vaccines have arrived at Glenair, we want to make sure that they're stored appropriately. First, we need to protect them from light, which hopefully all the packaging will do until we get them in the fridge. And then we want to ensure that the fridge is well equipped with temperature monitoring. So we want to record these daily in a log for auditing purposes. And when storing, it's best to not use the fridge door because the temperatures in the door are more prone to fluctuations as people open and shut it frequently. Similarly, we want to avoid the vaccines touching the insides of the fridge walls because those temperatures also are not as regulated. One little method we can do to help regulate and stabilize the temperature inside the fridge is by placing a couple full bottles of water, and water is able to then, once that's at the fridge temperature, able to maintain temperatures more readily. When we go to administer the vaccine, we always want to check the expiration date and visually look for any particles that might be in the liquid. This could be a sign that there's a defect in that particular vaccine or the vaccines have been contaminated, and we'd want to not administer those to our patient. All vaccines are going to be administered intramuscularly in the deltoid region of the patient's arm. With Fluzone high dose, that's going to be that larger syringe of 0.75 milliliters. And none of the 3 recommended vaccines listed should be mixed with any other type of vaccine. All 3 should be gently shaken before administration, while keeping in mind that the Fluad brand will look milky white versus clear, and that is normal. Next, we want to choose the appropriate size needle for our patient. So you can see that a 1 inch and 1.5 inch needle will cover almost all of our patient populations. So we want to assess their weight to determine which needle length we want to use. Once the vaccine has been given, it's important to monitor for any of our allergic reactions. Feelings of lightheadedness might arise. We want to have our patients stand up slowly to prevent any fainting episodes, and remind the patient that they may experience soreness in the arm, redness, and possible bruising at the injection site. And over the next few days, they might experience a heightened level of fatigue. So we have our 2 patient cases I'll present to you, and you can just think about these scenarios and how you might address them in clinical practice. So patient A is an 85-year-old female. She's presenting to the clinic with a sore throat, headache, and body aches. She states she feels more tired than normal, and she's been experiencing a dry cough. She states that these symptoms have been present for several days now. So thinking back to our chart, how would we diagnose our patient? Patient B is a 65-year-old male weighing 255 pounds. What vaccine would we recommend, and what needle size does this patient require for appropriate administration? Here are some of our references if you want to go dig deeper into any of the topics we covered. And with that, we'd be happy to take any questions you have about our in-service. We have listed our names and email addresses for your convenience. Thank you for listening.